Hey, it's Dr. Murphy. So today we're going to talk about erectile dysfunction, which is also called ED. So we'll talk about what that is, what causes it, what treatment options there are for it, and if you do take a medicine, what side effects to look out for. So erectile dysfunction is when you have trouble making an erection or maintaining an erection. And most of the times that's due to an issue with the blood flow to the penis. And so most of our treatments are targeting improving the blood flow. Now, there are some other causes outside of blood flow issues, which could be nerve damage. It could be medications that you're taking that's causing the ED. It could be your mental state. If you're depressed or stressed, that can increase your risk for it. If you've had trauma or surgery, for those who've had their prostate removed, they're at more increased risk of ED. So there's various causes, but like I said, majority of it is related to the vascular blood flow issue. And so whenever you have concerns for ED, we definitely want to explore risk factors for what we would look for heart disease, like anything that disrupts the blood flow. So high blood pressure, high cholesterol, diabetes, obesity, smoking, drinking alcohol. All of those are things that increase your risk of heart disease and cardiovascular disease. So the same thing applies here. Those same things increase your risk of erectile dysfunction. And so we want to do a good exam, just checking your genitals, checking your heart, checking your pulses, making sure you have good blood flow. We want to do some blood work, looking at hormones like your thyroid, your testosterone, looking at your blood sugar, your cholesterol, your kidney function, all of those things, just to kind of assess what risks do you have that could be contributing to this issue. And so whenever we investigate, depending on what we find, we'll tell you what you need to work on as far as your lifestyle, as far as if you need any additional treatments to get those chronic health conditions under control. Because once you do, your ED may get better even without a separate treatment for that specifically. And so I will go into the specific treatments for ED, but before I do want to remind you all to make sure you go and like this video and also subscribe to the Hey Dr. Murphy channel. So outside of doing things to help your blood flow, such as exercise, eating healthy, maintaining a good weight, keeping your blood sugar, your cholesterol under good control, all of those things. If we don't see improvement, we may look at prescribing medication to help with the erection. And we really want to make sure that you're not at risk of a heart attack. If something in your workup made us concerned that you may have a blockage in the heart, we may send you for additional heart testing before we would prescribe medication to treat ED. So the class of medicine that we use to treat it is called PDE5 inhibitors. And what that is a class of medicine that blocks an enzyme so that your blood flow improves in the vessels. And so it dilates the blood vessels, it relaxes, more blood can get through, and you can have an erection easier. And so the common names for that class of medicine you may have heard is Viagra, there's Levitra, Cialis, and Stendra. So Viagra, you hear the most because we've known it longer. We've had more experience with it. Its cost is low, so it's cheaper. Most insurances usually cover it. Although they may only cover a limited amount, they do cover some typically. But usually that's the one that we'll prescribe. And if you don't have good effect from it, we may switch you to one of the other ones. So whenever we give you the medicine, we usually start at the lowest and tell you to take it at least 30 to 60 minutes before sexual activity. And then it works for a good 4 hours. So you have a window there that you can use, but after 4 hours, it may not work as well. And Although it's active for 4 hours, that doesn't mean that you're going to have an erection for 4 hours. I do want to clarify that because some people get confused on that. If you did have a prolonged erection for hours, especially 4 or more hours, that would be a medical emergency and you would need to go to the ER to get that managed. But yes, so it usually once it works, usually when you're no longer stimulated, the erection is over and that's it. And you don't want to use more than one pill or one dose a day. So you have to wait 24 hours in between each dose. So most people take those medicines as needed. There are some cases where we'll do a low dose every day. It just depends. So you and your doctor will figure out what works best for you. But some people do find that the Cialis brand is more effective because it has a longer half-life, but it is more expensive. So again, that may be a limited option for you. So whenever we prescribe these medicines, we tell you what side effects to look out for. Some of the biggest ones are headache, flushing, dizziness. There's this thing called blue vision where you have a blue tint to your vision for a few hours. You can have diarrhea and you can have rhinitis where you have a runny nose or nasal congestion. So those are the most common side effects. But if you're not taking it every day, that decreases the risk of side effects. And you need to make sure that you're not taking any medicine that's a nitrate along with this class of medicine, because that would put you at a very high risk of severe hypotension where your blood pressure will drop really low and you could pass out. So nitrates are usually medicines that are prescribed for people with heart disease. So Imdur or isosorbide or nitroglycerin or some common name. So if you're on those, talk to your doctor. Make sure you're not taking that at the same time as erectile dysfunction medicine of this class. So if you've had a heart attack within the last 6 months or a stroke, we won't prescribe this medicine. You have to wait until after that time, at least 6 months before this medicine could be considered. But for people who the medicine don't work for, there are some other things that they found to be effective. There's some devices, like there's a vacuum where you could suction to increase the blood flow. There's injections, there's penile implants, there's surgeries. And so we would refer you to a urology specialist to talk about those other treatment options if the medications didn't help. So that's just an overview of erectile dysfunction. And it's just really important to recognize that many of the same things that cause heart attacks and stroke also put you at risk for erectile dysfunction. So doing things to, just keep your regular day-to-day things that staying active, eating healthy, staying at a healthy weight, all of those things impact your sexual life as well. So if you have any questions about that, please leave a comment and I'll reply. Thank you.